Hello, my name is Dr. Tall Paul Simon, psychiatrist. I am a psychiatrist licensed to practice psychiatric medicine in Missouri, and I trained at Washington University where I did my psychiatry residency. I am a clinician. I practice psychiatric medicine every day, well, except for Sundays. I don't work on Sundays, not anymore anyway. And so I have a lot of clinical experience. I wanted to talk to you a little bit about clozapine, a medication that has been out for quite a while. It is the most effective psychiatric medication for a lot of different indications, severe indications that I think people should know about a lot more. But before I get into it, please like and subscribe to this channel, and that encourages me to make more videos like this that I want to get out to more people. Now, clozapine is a medication that came out in the 80s and is the most effective medication for severe treatment refractory or treatment resistant suicidality and schizophrenia, so psychosis, and it's used for bipolar as well. Now, you may ask, well, why aren't more people on this medication? Well, I have some theories, and there are some good reasons why it's not used in every single case. For people who are run-of-the-mill depressed, maybe have been hospitalized for suicidality or depression, or it's really not a first-line treatment for them because it is prone to side effects. Now, clozapine, or Clozaril, which is its brand name, is what we call an atypical antipsychotic. So we call it that because it is not like the older antipsychotics that were out, like haloperidol and Thorazine and some of these others that are really heavy duty and work primarily on a neurotransmitter called dopamine, which if you get too much in certain parts of your brain can make you psychotic and hallucinate and be paranoid and different things like that. Now, it also works, the clozapine does work on serotonin, which is implicated in depression in a lot of cases, and anxiety as well. So clozapine was one of the first medications in a class that worked on dopamine, but also on serotonin. And that means it has a wider range of uses for in mental health situations. Now, as far as its efficacy, it appears to be the most effective medication at treating schizophrenia and psychosis. So what does that mean? Well, it means that we should use it more often because it works better than any others. Now, why don't we use it as often? Well, it can cause weight gain, or appetite stimulation, drooling. You know, it's a heavy-duty medication that can cause a lot of side effects for some people. Now, the one side effect that really blocks its usefulness or practical utility is that in about 2 or 3% of people, it can reduce your white blood cells. So your white blood cells control your immune response. So if you're suppressing your immune system by suppressing white blood cells, well, that can be dangerous, right? Some people shouldn't take it if they have like seizure disorders, but that's pretty uncommon. And there are other indications, you know, for which you really shouldn't take it or should try something else, you know, if you have like diabetes or you have a weight problem or something like that. It's like, well, it's maybe not for you, but I have used it in a lot of cases of severe treatment-resistant schizophrenia and depression, and I've found it to be life-changing, life-saving, in fact. I've had a number of cases of self-harm where people would get so depressed they would self-harm and cut, you know, maybe not intending suicide, but really toying with that idea and heading that direction. So while they didn't mean to try to kill themselves, they in effect were, just because They're trying to seek some kind of relief from their emotional pain. So while not overtly psychotic, those people were so severely depressed and perhaps chronically suicidal. By that I mean, if something happens, or they're even lonely, or feel abandoned, or have a breakup, or something bad happens, or maybe not, they become suicidal. It's an overreaction, not on their part like purposeful, but it hits them way harder than it should. So they sometimes will head towards suicide. So in somebody like that, typically we use antidepressants and maybe a mood stabilizer, maybe a combination of medications to try to keep them out of the woods, so to say. But what happens if that doesn't work? Well, the end-all be-all is clozapine or clozaril, because again, it's the most effective medication now, and we don't use it as much because of those side effects. Now, the other medication that we don't use as much that has been shown to help with treatment-resistant suicidality is lithium. Lithium, the good old mood stabilizer, but again, that's prone to side effects as well. Now, going back to clozapine, I don't want to start talking about lithium all of a sudden, but that's maybe worthy of another video. Clozaril, when it came out, they did the studies, they got FDA approval, and they found that it was so effective that it quickly rose to the top as far as clinical options. Now, back in the 90s, in the 1990s and early 2000s, there was a lot of other medications that were coming out that in this atypical antipsychotic class of medications, like Risperdal, Zyprexa, Abilify, and others. And these are also very good medications that supposedly don't have the white blood cell suppressing effect, but they're not as effective as clozapine. They have their strengths and weaknesses. Different ones are more likely to cause weight gain than others. Like Abilify is less likely to cause weight gain than Zyprexa or Risperdal or clozapine for that matter. But it's less effective in treating psychosis, less effective in treating chronic suicidality. So I have a little conspiracy theory that I'd like to share, that the drug companies like Pfizer and different companies, they decided, well, we can't really beat this clozapine, this clozaril that's already on the market. So what they did, they said, well, this small percentage of people can suppress their white blood cells. Let's work with the FDA to throw up some barriers to clozapine's use. So what they did is they got the FDA, this is my conspiracy, okay? I don't have any data to really confirm this, but I don't put anything past drug companies, honestly. They convinced the FDA to require any person that takes clozapine that they have to get blood labs drawn every week for the first 6 months of their medication trial. So if you don't get your blood drawn to show that your white blood cells are normal, then you don't get your medicine. So the pharmacists, by law, have to make sure that blood was drawn. And the physician, has to make sure it gets that, or else, the person doesn't get their medication. After 6 months, the person's required to get their blood drawn every 2 weeks for another 6 months. And then after a total of a year, it's once a month. So I have a lot of people who, let's say, are severely mentally ill, and they may not have the best social support system or best insurance, or it's just, really unmanageable to get your blood drawn every year and make sure that paperwork goes to the right place. And it's a real pain. So a lot of times we see people who should be good candidates for clozaril or clozapine, same thing, that aren't put on it because of that practical barrier that was put in place by the FDA. And I suspect in collusion with these other drug companies that were coming out with these very, very expensive alternatives that eventually became the standard of care because they didn't have that onerous blood lab requirement. So clozapine, Clozaril, is a very effective medication. I've never seen it suppress anybody's white blood cells. Honestly, it can cause weight gain and it can be quite sedating, but you can dial the dose in. So typically somebody, let's say with bad schizophrenia or something, they recommend taking 200 milligrams or more of that medication. But I've had people who had schizophrenia and they couldn't even tolerate 50 milligrams. For some reason, they were very sensitive to the medication, but otherwise it worked very, very well. So they just have to be on a much lower dose range. So 25 milligrams, 50, 75 milligrams total in a day's time works really well for them. Other people need much higher doses, 200, 300 milligrams. It can really help with sleep. It can really help with anxiety. And again, it can really help with that treatment-resistant suicidal stuff. So I think it's a very useful medication, underutilized. And I really wish more people would prescribe it because it is so effective and I've seen it work so well. It is generic now, so it's cheap, but it's just a pain to deal with, quite literally, with the blood labs. So maybe if you've struggled with some of these issues or know somebody who's struggled with severe mental health stuff, may want to mention that Clozaril or clozapine as a potential option for them. Okay. Hope this has been useful. Please spread the word about that medication, and please make any suggestions about questions or topics for me to put a video together for. Again, I appreciate you watching and supporting. You all take care. Bye-bye.